Hello, my name is Kristen Ball, and today I speak against the United States Preventative Services Task Force guidelines for breast cancer screening. These guidelines call for mammograms to begin at age 50 and continue biannually after that. These guidelines are in direct conflict with those by the American Cancer Society and National Institute of Health. The American Cancer Society and NIH call for mammograms to start at age 40 and then continue annually or biannually until age 50, with annual mammograms after that. This conflict of guidelines means something to me, as I was diagnosed with breast cancer at age 47 during an annual breast screening mammogram. My breast cancer was at stage 0 before it had spread to surrounding tissue or lymph nodes. Yes, I was lucky, but I hate to think of what could have happened had I or my doctor been following the United States Preventative Services Task Force guidelines. Maybe, just maybe, it would have been caught at a more invasive stage that would have required a more lengthy and risky treatment. As I speak to you today, I will first go through exactly what a mammogram is. Second of all, I will be giving you the reasons that you should have a mammogram. And the third part of my speech will be a discussion of the potential harms of starting mammograms at age 40 versus the benefits of starting mammograms at age 40. As we start, what is a mammogram? A mammogram is an X-ray of breast tissue. It can find changes in the breast before any signs or symptoms are apparent, or before a lump can be felt. It can also find microcalcifications, which are tiny deposits of calcium that may point towards future breast cancers. Now that we've talked about what a mammogram is, let's talk about what are the reasons to have a mammogram. Regular screening through a mammogram has led to decreased deaths. It is an important part of any breast screening plan. And because a mammogram is done before any symptoms are apparent, the early detection allows more treatment success. There's less disfiguring and less need for reconstruction after. It's the difference between a lumpectomy or excision of a lump and a mastectomy, which is removal of the whole breast. Now that we've talked about what a mammogram is and the reasons to have a mammogram, let's talk about the potential harms and benefits of starting mammograms at age 40. Excuse me. The potential harms of starting at age 40, as stated by the United States Preventative Services Task Force, are that finding a cancer does not mean that you're finding a cancer early doesn't mean that you're saving lives. The cancer detected can be so small that it would never require any treatment, or the cancer could be so fast moving that treatment is not effective anyways, or the person may be suffering from other life-threatening illnesses that no matter what happens, the breast cancer isn't going to be the reason that they die. The second potential harm is that a mammogram can provide false negative results. Mammograms can miss up to 20% of cancers that are there at the time of screening. Most of the time this happens with dense breast tissue that you would see in a young person versus an older person. The third potential harm is that mammograms may cause overdiagnosis and overtreatment. Small, non-invasive cancers do not require any treatment. And because we treat all cancers as being invasive and life-threatening, they will be treated. But these small ones may cause unnecessary treatment and the side effects of these unneeded treatments. The fourth potential harm of starting at age 40 is that X-rays always have some radiation exposure, and the year-to-year X-ray exposure, the combination of having many years of exposure may have some effect on their breast tissue. Although the small amount on radiation has never been shown to be a factor. Now that we've talked about the potential harms of starting at age 40, let's talk about the benefits of starting at 40. The Cancer Journal did a study of 1 million women, and they found a 29% decrease in deaths in those persons having mammograms in their 40s. In a 2003 New England Journal of Medicine study, they found that 4 out of 1,000 persons had life saved by mammograms. It seems that early detection means that treatment can start early and is more successful. In conclusion, the decision as to what age to start mammograms lies with the individual woman and her doctor. Family history, genetics, and other factors influence when mammograms should begin. Clearly, mammograms are an important screening tool in detecting breast cancer. And if early detection is the goal, then we need to be starting mammograms at age 40, as specified by the American Cancer Society and NIH. It is my hope that the United States Preventive Services Task Force will revise their guidelines, because if just one person is diagnosed with later stage breast cancer because of the task force guidelines, then that is one person too many. If you take nothing more from this speech, I advocate following the American Cancer Society's guideline to start mammograms at 40 and continue to a schedule of regular mammograms. Thank you very much.